Just in, Bay Area ICU availability has reached record lows, dropping down to 5.1% today. It was 6.3% yesterday. ICU capacity also fell sharply in the Sacramento area to just under 7%. The stay-at-home order there was officially extended today. In the past 24 hours, the state has reported more than 53,000 new COVID-19 cases, bringing the total number to over 2.3 million. Positivity rate over the last 14 days is at nearly 13%, and more than 21,000 people infected with the virus are in the hospital right now.
As New Year celebrations wrap up, we saw a long line of cars at the San Mateo County Event Center today, people waiting to get tested for coronavirus. KPIX5's Wilson Walker explains it's really too soon to tell whether the holidays are fueling a surge. Wilson.
Right. Remember, we keep saying that everything you see in the hospitals reflects what was going on a couple of weeks ago. We had the big surge in cases coming out of Thanksgiving. There was concern about that continuing through Christmas. But remember, things started to turn around a little bit during December. Right now, we're in what you might call a bit of a fog as far as information goes on testing. We're going to know this week the way things are going, and it might bring some encouraging news.
It'll take a week or so for it to all sort out. I mean, I think right before Christmas, we were starting to see a dip, which was good, and we saw it across several indicators.
With December dominated by ICU strain headlines and worries about a Christmas surge, it was easy to miss the bit of good news. The post-Thanksgiving surge did finally run out of steam.
We have seen some softening of the rate of rise of our cases.
Whether or not that positive trend has continued is a little hard to figure out right now. The holidays and the weekends have reduced testing and put lags in reporting, so maybe another week or two before we can tell.
I mean, I think things are going in the right direction. The question is whether there's been damage done to these trends by New Year's, and we're not going to know until we know.
Southern California, however, is a different story. 20,000 new cases in Los Angeles just yesterday, with a positivity rate over 21%.
Well, you know, there's an interesting thing that's being kicked around, which is this British variant strain has been found in San Diego. And the question that's sort of now kind of circulating is whether this might be strain differences that are causing more disease in Southern California. I think that's an awfully facile explanation based on 5 cases out of, as you said, 20,000 yesterday. But it's something to be looked into.
Back in the Bay Area, improving numbers would be just that, an improvement from early December. Real progress would still be a ways off.
At some point, we'll be able to extract ourselves because a lot of people have gotten vaccinated. And I think we have to be, kind of on our game still for another several months until we get the vaccines firmly in place.
All right, back to testing. Weekends are a little tricky. If you follow the numbers, you know that everything kind of dips down Saturday and Sunday. Fewer testing sites open, reporting gets sort of backlogged a little bit. The site here in San Leandro, actually one of the relatively few that's open in the county on a Saturday. So when we get to Monday, Tuesday, Wednesday, everything reboots again coming out of the holiday. There's going to be some critical testing numbers. What do we start to see in the Bay Area? Are the cases going to continue to slide back a little bit and maybe in a week or two give some relief to the hospitals, or do things pick up again? Next 7 days will be very, very important. We are live here in San Leandro. Wilson Walker, KPIX5.